PCI, also known as percutaneous coronary intervention, is a general term for a large class of interventional treatments for coronary artery disease. It is used to treat stenosis of the coronary arteries of the heart and to restore blood supply to the vessels. Before the procedure begins, the surgeon anesthetizes the skin at the puncture site. The radial artery approach is often chosen. Once a Seldinger needle has passed through the skin into the artery, a guide wire is passed through the needle into the vessel. The needle is withdrawn over the guide wire and replaced by an introducer sheath, and once in place the dilator and guide wire is withdrawn. The sheath is left in the vessel to establish a near bloodless surgical access. An angiography guide wire is fed through the vessel to assist the catheter in reaching the aortic root. The catheter is advanced over the guide wire and moved into the coronary artery. Contrast agent is injected into the artery and X-rays are taken to determine if there is a lesion. If the stenosis is found to be more than 70%, stenting would be usually performed. To perform stenting, the angiography catheter is replaced with a guiding catheter linked to a Y connector and a fluid management set to extend the vascular circuit in order to monitor the hemodynamic signal and deliver contrast agents, etc. A cardiovascular guide wire is then inserted into the coronary artery and a balloon catheter is delivered along the guide wires to the stenotic site. Expansion of the balloon catheter with an inflation device deploys the stent and opens the artery. The balloon catheter is deflated and withdrawn to complete stent deployment. If the stent is not adequately inflated, expansion with a PCI balloon catheter is required. After all catheters are removed at the end of the procedure, the introducer sheath is removed. A pressure bandage is then applied over the wound to provide hemostatic pressure, assisting the closure of the artery.